Hello, everyone. This is Dave Too. I'm doing a video over the Affordable Care Act, progression, polarization, and perpetual debate. The Patient Protection and Affordable Care Act, often referred to as Obamacare, stands as the most significant overhaul of U.S. healthcare system and since Medicare and Medicaid in 1965. Enacted in 2010, the legislative has designed an expansive healthcare insurance coverage, improved consumer protections, and reduce healthcare costs. Progression was marked by both substantial coverage gains and intense, enduring political opposition. The progression and initial coverage of ACA, the ACA did not emerge ex nihilo, but built upon prior state level efforts. Most notable, the 2006 Massachusetts Healthcare Reform Act, signed by the governor Mitt Romney. The ACA's core mechanism was to enforce shared responsibility across insurers, consumers, and employers. That's a basic rundown. The initial coverage mandated was protection, prohibition of discrimination, essential health care benefits, EHBs, small group plan were required to cover a standard set of 10. Dependent coverage, children could remain on parents' plan until 26 now. Individual mandate, most require health insurance. So this was a mandate to include health insurance. And the penalty was eventually set at $695 or 2.5% of the income by the 2016. Employer mandate, if they have 50 or more workers, they are required to offer the Affordable Care Act, affordable coverage. The marketplace, state-run, federal-run health insurance marketplace, subsidies, advanced premium tax credit, cost sharing, and reduction. Between 100% and 400% of the federal poverty level, FPLO. Established premiums and out-of-pocket is based upon that for each individual with incomes between there. The Medicaid expansion, the law initially aimed to expand Medicare eligibility to all adults with incomes up to 138% of the FPL. A 2012 Supreme Court ruling made this expansion optional for states. The advantage and disadvantage. Coverage. The uninsured fell to a record low of 7.7% in 2023, and from 14 to 161%, or 14 to 16.1 before the ACA. So basically, it went from 14 to 16.1 up, and covered the ones that weren't covered, uninsured, were 7.7%. So almost cut it in half to less than half. Disadvantages: rising premiums and deductions, while subsidies helped unsubsidized premiums and high sum plans. Yeah, so there's where it's helped. That was the subsidies, and now they're trying to reinstate them. Protections: eliminates lifetime and annual limits on coverage and guarantees coverage regardless of pre-existing. Basically, pre-existing said that you have to cover this. Plan choice / access. In the early years, the marketplace was limited and fewer choices. Yeah, it was fewer choices, basically limited. Affordability, provided subsidies for make coverage affordable for millions, basically low to moderate incomes. Mandates taxes. The individual mandate new tax fees if they aren't covered by medical. That one was removed. That was the original startup, by the way. Delivery planned out the Medicare Part D donut hole and promoted new payment models, slow cost growth. Yeah. Medicaid gap. The Supreme Court ruling on the Medicaid expansion created a coverage gap in state that opted not to expand this program, leaving poor and low-income individuals without affordable care. Mitt Romney's plan, as in 2006 in Massachusetts health reform, dubbed Romney Care, served as a foundation for the blueprint of the ACA. It had individual mandates, both uninsured individuals and purchase coverage or face penalty. The one that they said they don't want in the nationwide. Affordable credits provide subsidies. Again, they provided subsidies. It's a copy of this. At one time, it was a copy of the Mitt Romney plan. Guaranteed insurers both prohibit insurers from denying coverage on pre-existing conditions. Exchange both established marketplace for purchasing insurance. Sounds similar, doesn't it? The key differences, here they are. Romney Care was state level initiatives, did not include provisions for Medicare like savings, the national employer mandate, or extensive payment reform. A little better, I'd say. Romney Care successfully achieved non-elderly uninsured rate to 5.8% by 2010, demonstrate the effectiveness of the model. It was a Republican plan, Romney Care, that they based the ACA on. The Affordable Care Act, which they dubbed Obamacare because he wrote a plan. They changed his plan and expanded it to many more pages. So that's why I don't agree with still calling it Obamacare, but they're using Obamacare to make it a bad thing. It was a Republican plan, period, plain and simple. Mitt Romney plan, actually, and I think Bernie Sanders has it too. Republican opposition and legislative passage, they opposed it. Yeah, they weren't unified, multifaceted. Yeah. Reason for Republican opposition, government overreach. They're saying they went too far mandating this. Increased spending and taxes. Basically, we were increasing the Medicaid expansion, was increasing it to new entitlement programs, and was funded by burdensome taxpayers on employers, insurers, called the Cadillac tax, high cost tax, which is what taxes are for. So they didn't want to pay, they didn't want the taxes to go for health care. They wanted to go for something else. But if you took the Medicare and started Medicare for all, you could dump in what's there already and expand the debt. Don't put a debt ceiling on it. Don't put a ceiling on it for input. Don't and raise the income a little bit, raise the tax a little bit, and that could have market influence. Republicans oppose the extensive new regulation on the private insurance market, arguing they stifle competition. Limited consumer choice does it. Yeah, that was in the beginning. It was, but they changed it up a little bit. Bureaucracy, the creation of the new government body, like an independent payment advisory board, which I don't agree with, because they could have combined it in with the Medicare, Medicaid, and started going to Medicaid for all or Medicare for all. AB concerns. Many oppose any provisions that could be construed as allowing public fund. I do not agree with this at all. Abortion, the AB should be taken out of it, period. Plain and simple. That is a woman's health care, and that's where it should stay. I know people opposed. I'd say it's pre-choice, but I don't think they understand where the cutoffs were. And if you looked at the original Roe versus Wade, which was actually more about private patient doctor confidentiality, that stayed there, which is what the whole thing was, but it just included the AB portion up to the third trimester. Before that, okay, they had different rules for it. After that, they had to get special permission and all that. So, and if it gets in the third trimester, it's going to be up to the doctor for the most part. Congressional votes and Senate requirements. The ACA passed two distinct pieces of legislation. The Patient Protection Affordable Care Act. This main bill passed in the Senate, strictly party line 6039, December 29, 2009. Senate requirement, the Senate required 60 votes to overcome the filibuster, pass the bill. blah, blah, blah. Democrats achieved this with 58 Democrats and 2 independents. So basically, they used the Healthcare and Education Reconciliation Act of 2010, ECRA. The the House initially refused to pass the Senate version without changes after Democrat Scott Brown won special election in Massachusetts, which eliminated Democrats 60 votes. Reconciliation. The reconciliation process allowed bills related to the budget to pass the House with a simple 50 majority. That's the reconciliation bills. Final passage, the House passed the PPAC on March 21st, 2010, 219 to 212, and the reconciliation bill passed in Senate 56 to 43 on March 25th, 2010. President Obama signed it in March 23, 2010. That's why they call it the Obamacare, because he signed it. But it was the House and the Senate. Yes, it was Democrat because they were fighting their own programs because they didn't want it nationwide. They didn't want that coverage. The ACA has undergone several significant legislative changes and judicial changes since its inception. This is from 2010 to 2025. Changes until 2025 to 2012, Medicaid expansion decision, Supreme Court ruling, states made Medicaid, Medicare expansion to the medical gap a non-expanding state. So in other words, that was the optional. In 2017, individuals mandated penalties zeroed out. In other words, if you didn't have coverage, you paid a fine. In 2017, it said no zero, no fund, no fines. In 2019, repeal of taxes, repeal of certain taxes and fees, the Cadillac tax on the high cost employers plan was also repealed. So they took away the Cadillac. That was a way to get more money from the higher income. It was a way around the tax cuts that they kept putting in, but it was rescinded in 2019. Okay, from 2021 to 2025, enhanced subsidies, American Rescue Plan Act, ARPA, and Inflationary Reduction Act. Significantly, generously, APTCs by eliminating the subsidy cliff, the 400% FP income cap. So they removed they eliminated the cap. Yeah, they eliminated the cap and lowered the required percentage of income paid towards premiums for all income. And B, subsidies proposed and need. ACA subsidies, APTCs, CSRs were to remain essential for making health and insurance affordable. Proposed subsidies reduce the cost of monthly and premiums, lowering the out-of-pocket deductions and copays for eligible individuals. The subsidies still critically needed, especially the enhanced subsidies. The prices went up. We went through C19, prices went up. They never came back down after C19. So that's why they're saying these subsidies need to stay in place unless they enhance them later on. Premiums would rise. In other words, if we take that away, they will rise. Enrollment will drop. Yeah, prices go up, less people can afford it. The subsidy cliff. Their current law will prevent to original subsidy rules in 2026, meaning individuals above 400% of the FPL would no longer receive financial assistance, potentially leading to increased uninsured among middle income families. They want to extend, it needs to be extended to, yeah. Republican alternatives and Medicare for all. Republicans opposed to a continuation of alternate plans. Republicans continue to oppose ACA because it's called Obamacare. They just need to remove that name off of it. They say on the cost, overregulation, and the structure of subsidies plan system. That's their main critique. It's a money sucking insurance companies. Yeah. Recurring proposal recently championed by President is to redirect subsidies funding federal payments currently to individuals directly to insurers. So it would be a direct payment or a refundable tax credit to individual. So yeah, but is there the money to make the payment? We don't know. If the direct payment refundable tax credit, consumer empowerment gives individuals direct control over the money, allowed them to shop for a plan of their choice, potentially even non-ACA compliant plans. Well, okay, that's weird. Yeah, because they're trying to, some of them stayed out of the ACA just so they didn't have to meet those requirements. Erosion of protections without the mandate of ACA compliant plans. Recipients could use the money for much better plans that lack essential benefits or could deny coverage for pre-existing conditions. Inadequate funding. The funds might not be enough to cover the full cost. That's one of the drawbacks. High risk pools, state-based flexibility, traditional GOP approach. Constantine shifts the sickest people, patients to state-run high-risk pools, potentially lower in premiums in the standard market. Flexibility allows for innovation. I'm summarizing my Substack, by the way. You can go read the full Substack. The underlying underfunding high risk pool, having historically been underfunded and struggled to adequate cover. Loss of coverage leading to an estimated loss. Yeah. The conversion to Medicare for all. Medicare for all is a single payer healthcare system proposed that would essentially expand the current Medicare program to cover all U.S. residents. Coverage and access, universal coverage, eliminating the uninsured zero premium, deductibles or co-pays for coverage services, ensuring affordable. Massive cost requires trillions of dollars in new federal spending, necessitates the substantial tax increase. Yes and no. When they do the Medicaid single payer and went to the Medicaid, they would have to just raise that. Yes, that they would raise that, which would increase taxes, but still would have all people in the United States covered under Medicare. They would all be covered, period. I think the benefits of that outweigh the cost. The benefits of the whole program, broad, comprehensive coverage, including dental, vision. Yeah, it covers everything instead of where you have to piecemeal it outside. Economic shock. Replacing employer-based benefits with M4As requires complex economy shift. I think we could do that. We could leave the taxes would be made up by the employer, so they could actually use the employer to make up the other half of Medicaid, Medicare. Raise it up a little bit and then take some from the employers to pay the rest. That would do it. Equity provides equal access to care. Disparities will not address health disparities rooted in social determinants like poverty, lifestyle, or environment. Yeah, but no, because if you do Medicare for all and you can include all the possible poverty possibilities so that you're on a sliding scale for copay and health prescriptions, and that's and you can find my that have references on. But if you expand Medicare for all, you put more taxes in to make up the gap a little bit, and then you would have the employers pay the taxes to make up the difference. That's where I think a lot of the failure of the system was, because when I was younger, the way it worked was employment paid half, the employer paid half, and the employee paid half, which made payment, well, not maybe not half, it's a little less than half. So that would cover them. They had good plans, but when they made the Affordable Care Act, for some reason the plans went to shit, and they did not require the employers to help unless they have over 50 people. Why can we not revert to the health care that the employer helps pay into Medicaid, Medicare to make up the difference so everybody can be covered with a little increase on the other side? It would take $2.1 trillion to, I think, to initiate that, if I remember the number right. It would also allow, then you could also raise it up and collect $4 trillion. If you collect $4 trillion, you could actually have every household basic cable and basic internet, which would improve the people can see they have TV and they have the computer access, which would allow for them to use the PPS and all that, and allow for them to have the computer and internet access, which is required now. Basically, you have to have some kind of internet access. So I think we should go for Medicare for all. You can agree, disagree, put your comments down, see if you have better ideas than I do. But let's continue this on. This is my fourth podcast, and I will end it here. Thank you for your time. Like, share, follow in the other places, and ensure to comment. And remember, you are loved no matter what you do. Thank you very much.